MIBES Academy is the first Italian e-learning platform dedicated to the healthcare field and health promotion. It was founded in 2021 with the aim of combining the advantages of in-person training with online education. Recorded videos can indeed be watched as many times as needed, while live sessions allow people to focus on clinical practice.
Okay. Well, I can answer you that at the beginning, our focus was mainly on manual therapy professionals. Today, our community is much broader. Physicians, physiotherapists, psychologists, nurses, pharmacists, patients interested in managing their own health, and teachers of various body-based and somatic disciplines. In addition, I can tell you that the platform now includes over 5,000 registered users with a wider community of more than 20,000 followers across our social media challenges and other 20,000 subscribers to our mailing list. It's a complex question because we are observing a growing demand for content that addresses both scientific foundation and practical, clinically applicable tools. The most requested topics include integrated clinical reasoning, management for chronic pain, stress-related disorders, functional disorders, postural and movement-related complexity, and on clinical protocols, and I can tell you communication and patient education. We are seeing that people now in this period are no longer seeking knowledge alone. They want to understand how to work more effectively with patients. So, how to integrate approaches, how to communicate, how to collaborate. Practically speaking, the platform is moving to our modular building block learning models, allowing each professional to construct their own personalized pathway. So we combine high quality asynchronous theoretical modules, live session for real-time interaction, and intensive hands-on practice in small groups. So healthcare education must be, for us, a concrete bridge between knowing and doing. This is why we have moved from simple forums to thematic working groups, shared clinical cases, and a regular meeting with faculty. The platform so has become a sort of virtual clinical environment where participants do not merely attend lessons. They grow as a community that reflects, debates, and updates itself. Today, healthcare professionals need a scientific and epistemological framework that embrace complexity. Traditional healthcare education rarely teaches epistemology, so many clinicians still rely on a positivist vision model, where phenomena are induced to simple linear explanation. Modern science, especially after post-Popperian shift, described by, for example, Thomas Kuhn, shows that knowledge evolves and that complexity condition cannot be understood through a simple viewpoint or discipline. This is precisely the spirit of from which the PNEI, Neuro Endocrine Immunology paradigm emerged. A model that recognizes the continuous interaction among the nervous, endocrine, immune, and psychosocial systems. And I can say that it reflects the complexity of human health for better than reductionist approaches. For this reason, we must move beyond rigid specialism. Conditions like chronic pain or stress-related disorders require, obviously, clinicians who are bilingual scientists, able to speak multiple scientific languages and integrate biological, psychological, social, and somatic perspectives. Only by overcoming disciplinary barriers can we develop models of care that truly reflects the complexity of beings.
In our experience, one of the key factors in building a real community of health professionals is having a common language. That's why we started from PNEI, Neuro Endocrine Immunology. And it allowed us to review our own training and to teach other professionals within a shared framework, a shared paradigm. Indeed, the first courses we uploaded on MIBES Academy were about PNEI and the principles of integrative care or the fascial system, so to unite different fields and professionals. And psychoneuroendocrine immunology comes from both scientific evidence and ancient traditions such as traditional Chinese medicine. And according to us, is if people are to form a community, they need to speak the same language and understand each other. Too often, professionals end up arguing among themselves just because they use terminology that is specific to their own field, but incomprehensible to others. And another fundamental aspect for promoting integrative care is providing training pathways that cut across different professions. In fact, when we talk about stress management, nutrition, physical activity, body awareness, or similar areas, we believe that these are skills every healthcare professional should have, at least for what concerns prevention and health promotion. Lastly, the cultivation of a community comes from the fact that teachers and students can go beyond our courses by collaborating through private messaging, forums, share materials, follow-up webinars, and other functions of our e-learning platform.
Diciamo, per la nostra esperienza, la difficoltà è veramente quello uscire dal proprio piccolo paradigma. Cioè, io sono Shatsuka, studio solo lo Shatsu, tutto il resto non mi interessa. Io faccio Tai Chi e Qigong, studio certi movimenti, utilizzo un certo linguaggio, tutto il resto non mi interessa. Ma perché? Perché trovare un linguaggio bilingue è cioè comunque richiede un impegno, chiaramente, no? Cioè è semplicemente questo, però è quello che permette in realtà la comunicazione tra professionisti differenti. Ehm, il punto è che noi stiamo cercando di invitare persone autorevoli, perché se lo diciamo noi, siamo gli alternativi di turno. Ma se lo dice il rettore dell'Università di Cagliari, professore dell'Università di Urbino, neurofisiologo riconosciuto a livello internazionale, se lo dicono altre persone che hanno importanza, autorevolezza, allora noi si spera che questa cosa vada a smuovere sempre di più nel tempo. Ecco.
In the training we offer, we've seen how important ECM accreditation is. In fact, ECM credits strongly influence what courses professionals choose, since their available time to attend to them is limited. So non-accredited courses are often overlooked. At the same time, there are many free ECM courses available thanks to sponsorships. And this makes it harder for businesses like ours to promote accredited courses. And this is exactly why we focus on offering ECM programs that provide real value through high-level practical and clinically relevant content. Besides, we host the only ECM accredited course by Dr. Franco Berrino, a well-known physician. And we believe to be on the right track, as many professionals have told us that compared to a lot of other ECM courses available online, ours actually support meaningful professional development.
Uh, Over the past 2 years, we have observed for us, two very clear developments. From one hand, a shift in the perception of the integrated care paradigm. For many professionals, integration once meant simply adding other technique. Today, increasingly, it means, for example, recognizing the person in their full complexity, considering stress, emotion, the nervous endocrine immune system, considering the posture, relationship, lifestyle, habits. And we saw that it's very important developing a shared therapeutic plan. Professionals are becoming more attentive, more willing to engage in dialogue, and more open to building collaborative care pathway with colleagues. From the other end, for us, a shift in clinical practice, yes, a shift in clinical practice. Users report improvements in the way they, for example, communicate with patients, assess clinical history, recognize the role of neuroimmune networks, integrate anamnesis, clinical reasoning, movement, manual therapy, and lifestyle interventions. Uh, these are real, continuous, and profound changes. The integrated model does not remain theoretical. It became part of everyday practice.
From an economic point of view, an organizational point of view, MIBES Academy is completely self-funded. We do not receive external financial support, so everything comes from our activities. Courses sales, learning management system services for professionals and schools, streaming of national and international congresses, publishing books, or outreach activities such magazine and webinars. Through these channels, we also offer advertising spaces for companies interested in integrative medicine. And economically, this system is essential for sustaining our project. On the other side, MIBES Academy is a complex structure. We need several people handling IT and platform management, technical support, administration, marketing, and in particular, the relationships with all the professionals who choose our platform to sell, to host their courses. And we think, looking ahead, that this is one of the most important factor for our growth. That is cultivating strong relationships with the people who already know us, from learners who train with us and professionals who trusted us with their courses. Maintaining these relationships creates a solid, a strong community that that follows our works and naturally helps spread it. And this is how MIBES Academy can grow together with the paradigm of integrative medicine.